to this anatomy lab in which we will be talking about the kidney. Okay, so there are so many objectives, but still we have tried to reduce it as much as possible. And we'll discuss some of the features of this kidney in some detail.
So how many options? How many options?
How many? Labs. To begin with, the kidney is also called as renal, or it is also called as nephros. Okay, nephrotic and other things. Whenever you use for the same kidney. So you can use the word kidney or venous or nephros. So as you know, it is a pair of excretory organs in the body, and they present on the posterior abdominal wall. What do you mean the posterior abdominal wall?
Posterior.
Which is the anterior?
Anterior?
Yeah, this is the anterior abdominal
Yes.
wall. Okay, this is the posterior abdominal wall.
Yes.
Okay, so this is the anti-abdominal wall, this is the posterior abdominal wall. Okay, so what you are seeing here is the posterior abdominal. This is the posterior abdominal wall.
Muscle.
Okay, yeah, the muscles, mainly the muscles. Okay, the posterior abdominal wall, and it is on each side of the vertebral column. This at the center the vertebral column, on either side is the kidney, and it is behind the peritoneum. So what do you call it as? Retroperitoneum. So this kidney is retroperitoneum. It is behind the peritoneum. Okay. So this is how you can describe it. Excretory organs which are present in the posterior abdominal wall on each side of the vertebral column, and they are behind the peritoneum or retroperitoneum. Okay. The shape is almost like, it looks like a bean. Okay. So it is bean shape, and the size is almost approximately 12 centimeters in length. Half of that is the breadth, 6 centimeters, and the thickness is half of that, 3 centimeters, rolled into 6 into 3. Okay, so this is the length, breadth, and thickness of this kidney. And if you try to locate it from the anti-abdominal wall, as you know, it is divided into 9 quadrants, right? So this will be related to the epigastric region, this one, then the left hypochondrium, then the left lumbar, as well as the umbilical. The center will be the umbilical, epigastrium here, left hypochondrium, and the left lumbar. So it will be in almost 4 quadrants of the abdomen. So you should know the abdominal divisions. If you try to trace it to the vertebral column, then it is at the level of T12 to L3. This is the extension of the kidney. From T12 up to L3 will be the position of this kidney. But if you see, actually, the right kidney is slightly lower. You see here in this picture also, you can see the right kidney is slightly lower compared to the left kidney. Why? Huh? Right kidney is slightly lower compared to the left kidney. Why? Which organ is there?
Liver.
The liver. Yeah. So the liver, good. So the liver is pushing the kidney on the right side lower down. So that's why the right kidney is slightly lower. So don't try to by heart the things. If you don't know the concept, then you can easily remember. Because the liver is present there, so this kidney is slightly lower. In the examination, you don't confuse which is lower, which is higher. Okay, if you know the proper concept, then you can easily remember the things. Okay, so the right kidney, because of the liver, presence of liver here, it has not ascended upwards. Actually, the kidneys initially, we'll talk about the development later, it is in the pelvis. Slowly they shift, migrate. Okay, but because here on the right side we have the liver, so it cannot migrate to the higher position as that of the left kidney. The weight is almost 150 grams in case of male and slightly lesser in comparison to the female. The females are slightly and reddish brown in color. And external features, it has 2 poles. The upper pole, this is the upper pole, and this is the lower pole. So the upper pole and the lower pole, and there are 2 borders. Medial border which is concave. You do not see here properly. In other pictures you can see it is concave here, and the lateral border is convex. Okay, the medial border is concave, lateral border is convex. 2 borders, 2 poles and 2 surfaces, the anterior surface which you are seeing from front and the posterior surface. Okay, so these are the external features: 2 poles, 2 borders and 2 surfaces. Okay, 2, 2, 2. The left kidney is little longer compared to the and narrow compared to the right kidney. So if you compare this left kidney with that of the right, so the left kidney, as I said, it is higher and it is longer. Okay, in that fashion, remember, it is in a higher position as well as it is longer and narrow compared to the right kidney. Because the right kidney has not ascended, it is becoming larger. Instead of ascending, it has become thicker. Okay. The upper pole is broad, on which the suprarenal gland. If you see here, it is not empty like this. On the upper pole, there will be the suprarenal gland, and the lower pole will be free. If you see here, there is the suprarenal gland on either side. So the upper pole is not free; it is always occupied with the suprarenal gland. If you see the transpyloric plane, what is transpyloric plane? What is transpyloric plane? What is pylorus? Part of the stomach. Okay. So to that part of the stomach, there is a horizontal line passing. This is called as the transpyloric plane. There is a plane which passes through the pylorus of the stomach. This is called as the transpyloric plane. Okay. If you draw this transpyloric plane, this part of the kidney is called as hilum. Okay. So it passes, this transpyloric plane will passes above the hilum of the right kidney and below the hilum of the left kidney. Why?
Because the right kidney.
The right kidney is below and the left kidney is higher. So if you see, if you pass this line, transpyloric plane, it will be passing above the hilum of the right kidney and below the hilum of the left kidney. This is the difference. Okay. And the long axis. What do you mean by long axis? Yeah, which passes through the length of the structure. If you pass this, it is not straight vertical, but it is oblique because of the kidneys themselves. The medial, the upper end is slightly closer to the mid plane compared to the lower poles. So it is not vertically straight, but it is slightly bent like this. If you see here, the upper pole is closer to the midline. This is the midline, so it is closer to the midline compared to the lower pole. So if you pass the vertical long axis of this kidney, it will be oblique like this. Okay. So this shows the direction of the kidney. The anterior surface is irregular and posterior surface is flat. Okay. Why?
Sure.
Why the anterior surface is irregular and posterior surface is flat?
This,
The posterior abdominal wall, good. The posterior abdominal wall is compressing the kidney, so it is sitting on that line now. So that's why it is flat. Compared to the anterior surface is free, except the structures which are coming in contact. Okay, so the anterior surface is irregular, the posterior surface is flat because of it is lying on the posterior surface. The medial border is concave and the lateral border is convex. As we have seen, the medial border is concave like this, and the lateral border is convex on either side. Okay. The structures arranged at the hilum of the kidney are important. Why they are important? The structures arranged at the hilum of the kidney are important. Why?
Because
How do you identify if the two kidneys are given to you? How do you identify the right kidney with the left kidney? How do you differentiate?
Shape and some different size.
Shape is same. It is
Renal
kidney
artery.
shape. If you turn like this, it will become
Renal
right left.
artery.
Huh?
Someone direct had one direct. Renal artery.
Renal artery, okay. Suprarenal gland, but still, with naked eyes, you cannot make much difference with the suprarenal gland.
Direction of the ureter and
Direction of the ureter. Okay, if it is on the left side, it will be like this. If I turn the same kidney on the side, it becomes the
but
right.
the flat surface,
Huh?
flat surface
Flat
will be.
surface, still again that you cannot make out exactly.
But if
You are not
you
very
make
much
it,
sure, huh?
if you the direction, what he said, if you make it like this, you'll see that flat surface should be posterior.
Yeah, that's what I said. Flat surface and irregular surface, still sometimes you cannot differentiate.
But you can.
Yeah. Arrangement of the structures, as your friend said and he said, arrangement of the structures at the hilum of the kidney is very important. What is arrangement? Can you tell? Okay. So the arrangement or the structure at the structures at the hilum of the kidney is very important. So the first structure which you come across will be the renal vein. If you see here, is the renal vein. You see this picture. So the first structure which you come across will be the renal vein. Behind that will be the renal artery, and the most posterior will be the renal pelvis. So whenever a kidney is given to you, try to identify these structures. You might not differentiate between the artery and the vein, but you can identify easily the pelvis and the ureter, right? So as soon as you see, try to see, keep it on the most posterior side, then see whether it is on the right side or on the left side. Okay. Whenever you see the structures, try to put the pelvis and the ureter on the posterior side, and then you make out. If you bring this, if the kidney is on the left side, it is posterior. When you bring it on the right side, it becomes anterior. So then you say that this is not the actual position of this kidney. Okay, always so. That's why always whenever the kidney is given in the examination, try to identify the structures at the hilum of the kidney. The most posterior should be the renal pelvis and the ureter. Okay, so if you put it on the posterior side and identify the upper and lower pole, upper pole you can easily identify because always there will be suprarenal line. Okay, so identify the upper pole and put the renal pelvis and the ureter on the posterior side, then it becomes the side of the kidney. Okay, so this arrangement of the structures at the hilum helps you to identify the side of the kidney. The first most anterior will be the renal vein, then the renal artery behind that, and the renal pelvis will be the most posterior. Okay. The next is the capsules of the kidney. Capsules of the kidney is very important because it is well protected and it prevents from lot of infections and other injury and other things. So the capsules of the kidney is very important. The first capsule is the fibrous capsule itself. What is fibrous capsule? What is fibrous capsule?
Capsule around the
fibrous tissue. Okay. How it is formed? Usually,
what's
in all the organs.
Two layers, right upper, like that.
no that covering هذا.
Okay, connective tissue. How it is formed?
What do you
The
mean?
thickening of the parenchyma of the organ itself form the it gets modified and it forms the capsule. Okay. So the first structure is the capsule of the kidney, fibrous capsule of the kidney itself, which is totally adherent to the kidney. That will be the first structure, capsule. The second is called as perirenal fat or perinephric fat. You see around this there is perinephric fat. Okay, just around this yellowish, around the brownish part, this yellowish part is the perinephric fat. This is the second layer, which is from the second covering or second protective covering. The third is the renal fascia. Very important fascia here. So anterior, it has two layers, anterior and posterior. So this is called as the renal fascia. These thin lines, blue lines. Okay. So these are the third layer, which is called as the renal fascia. The fourth is called as pararenal or paranephric fat. Okay. So this forms the bed of the kidney, which gives the cushioning effect to the kidney. If you are jumping, if there is any trauma or anything, it is well protected. It has least injuries because of this thick layer of paranephric fat. Okay, so there are four layers. Yeah.
What's the difference paranephric and perineal?
The first is the fibrous capsule itself. Okay, this brownish line which you are seeing around the kidney. Okay. Second, that is the perinephric fat.
Yes.
The perinephric. Then there is renal fascia. The renal fascia. And the fourth is the paranephric fat. Okay. So there are four layers. Any confusion?
There is two fat.
Yeah, two fats. Yeah. Perinephric as well as the paranephric.
One inside the fascia and other
Outside
foot.
the fascia. Okay, so there are two. If you have seen the kidney of the sheep when you are cutting, there is lot of fat around that. Okay, this all are the part of the paranephric fat as well as the perinephric fat, which gives cushioning effect and it is well protected from any injuries. Okay, so these are the four coverings of the kidney. If they ask you in the examination, the capsules or the coverings of the kidney, you should be able to mention these four. Okay, among these, the renal fascia is very important. It can itself can be asked as a short notes. Okay, so this is the renal fascia. So as I said, it has two layers. It is nothing but the condensation of the extra peritoneal connective tissue around the kidney, and it has two layers. One is the anterior layer, which is called as the fascia of the throat. So this is the fascia of the throat, anterior layer. Then there is the posterior layer, which is also called as the fascia of the glottal canal. So here is the posterior layer, second layer. So both these layers will be joining, fusing at the lateral border of the kidney. See here. So both these two layers will join at the lateral side of the kidney and continue the fascia of transversalis. The fascia of the posterior abdominal wall, fascia transversalis. So it forms the fascia transversalis. Both layers fuse at the upper end of the kidney also. They fuse at the lateral border of the kidney as well as they fuse at the upper end. Upper end is important because they form a ligament called as the suspensory ligament of the adrenal gland. Actually, I said on the upper pole of the kidney there is the suprarenal gland. This fascia, the two layers will go and join at the upper pole between the suprarenal gland and the kidney. Then the second layer will go above and get inserted above into the diaphragm. Okay, to the subdiaphragmatic fascia. Okay, now that actually it has to cover the kidney completely. Now it is actually covering the suprarenal gland well. Okay, so if there is any descent of the kidney, only the kidney will descend. The suprarenal gland is held in its position because of this ligament called as the suspensory ligament of the adrenal gland. Okay, did you get it? No? I said the kidney is covered by two layers of the renal fascia. Okay, on the lateral side. It is also covering the kidney above. Okay, when it covers the kidney above, it goes and joins at the upper pole below the suprarenal gland. Okay, below the suprarenal gland. Then it again divides and covers the suprarenal gland again. Then it goes to the diaphragm and get inserted there. Okay. Now, if there is descent of the kidney, it is not covering below, so it is free. Okay. If there is any descent because of any abnormality in the kidney, only the kidney will descend. The suprarenal gland will be held in its position. Why? Because of this suspensory ligament. It is covering totally the suprarenal gland. That's why it is called as not the suspensory ligament of kidney, but it is called as the suspensory ligament of the adrenal gland or suprarenal gland. Okay, so this is the importance of this renal fascia. It is well protective. It prevents from all infections and trauma, and it has two layers, and the two layers are getting fused at the lateral border as well as the superior border. Superior border, it is important because it totally covers the suprarenal gland and it forms a ligament called as suspensory ligament of the suprarenal gland or adrenal gland. Now, if you see here, the kidney is held in its position above. It has come ascended upwards and it is actually in this position. Actually, it cannot be in this position. It has to fall down if there are no supports. So how it is held in its position here, in this position? Okay, the factors which are keeping the kidney in its position. One is the pressure which is exerted by the neighboring viscera. There are all, the abdomen is not free, it is filled with so many viscera, and the pressure within the abdomen itself will hold the kidney in its position. Second is the renal fascia, which I showed you. Okay, and the renal fat. These also hold it in its position. And the third important thing is the pedicles of the kidney. So these are the pedicles of the kidney which hold the kidney in its position. The pedicles are here, which contain the ureters. So these ureters and the pedicles, they have lesser importance, but still they help in the support of the kidney. Pedicles are the upper continuation of the ureters. These are the ureters, right? So this part, pedicles, these are part of the pedicles of the kidney. Okay. So these structures will be holding the kidney in its position. So there might be a question which they might ask you, what are the factors which are holding the kidney in its position? So you should be able to mention these three. One is the pressure within the abdomen because of the viscera in the abdomen. Second is the renal fascia and the renal fat. The third is the pedicles of the kidney. Coming to one more important structure, a parallelogram, which is important surgically. Okay. Again, clinically it is important. There is objective also. So they might ask you the parallelogram in the examination. So they might ask you what is Morris parallelogram. So you should know what is this Morris parallelogram. One is this is the parallelogram which is drawn from behind. This is the position from where you can approach the kidney. If you want to do any surgeries, you cannot go from front because,
Yes.
as I said, it is on
Posterior.
the posterior abdominal wall. So if you are going from here, so you have to go through so many structures to push them outside, and then you have to reach. But as I said, it is retroperitoneal. It is behind the peritoneum, so you can easily approach from behind. So if you want to do any surgeries for the kidney, then you will be approaching this kidney from this Morris parallelogram. So what is this Morris parallelogram? If you draw two vertical lines, one from the midline. This is the midline. How do you identify the midlines? By the pedicles of the vertebra. So there are spine. Okay. So try to feel the spine. From there, measure two vertical lines. One is 2.5 centimeters from the midline here, and the second is 9.5 centimeters from the midline. So take two vertical lines. One is 2.5 centimeters from the midline. Second one is 9.5 centimeters from the midline. Then put two vertical lines. Okay. Then you put two horizontal lines. One is from the T11 level, and the second one is at the L3 vertebra. One is at the T11 vertebra, and the second one is at the L3 vertebra. So if you put this, you get a parallelogram, like a box. Okay. So within this is the kidney. Okay. Within this is the kidney. So this is called as the Morrison's parallelogram. Okay. So how do you draw this parallelogram? One is 2.5 cm, one line, vertical line, 2.5 centimeters from the midline. Second vertical line, 9.5 centimeters from the midline. Both are from the midline. Okay. Then two horizontal lines, one at the level of T11 vertebra, second one at the L3 vertebra, and you get a parallelogram. And this is called as the Morrison's parallelogram. Yeah, for these surgeries or doing any applications on the kidney, then you can approach this one. Second one is, I will tell you. Before that, the hilum is at the level of L1 vertebra. So the hilum is the hilum, so it is at the L1 vertebra. Okay. So one is you can do surgery. Second is the pain of the kidney. Actually, it starts from behind here. Okay, this area is called as loin. Okay, and it has a typical pain. So it starts from the It starts here in the back. It starts like a back pain, then it radiates like this, and it goes to the groin. So it is called as pain starting from the loin going to the groin. So there is a typical pain of the kidney, or if there is any infection, or if there is any stone in the pelvic or the ureter or somewhere. Okay, so it starts from the Morrison's parallelogram this here. This is called as the loin area, and it radiates like this and goes into the groin. So this is the typical pain of the kidney or the ureters. Okay. So this is also important because of this one. Okay. So this is mainly important because of the surgery. If you want to do surgeries, this is the Morrison's parallelogram. Coming to the relations, so whenever you are approaching this kidney, you should know some of the important relations. So there are anterior relations as well as posterior relations. So it is different for the right and left side, anterior relation. Posterior relations are almost similar, only the anterior relations, they are different. Okay. One is on the top, both there will be the suprarenal gland or adrenal gland. And apart from that, on the right side, the upper part will be the liver, the area for the liver. Okay. And on the medial side, it will be the duodenum, the four parts of the duodenum, especially the three parts will be at this part near the hilum. Okay. Then below we have the coliflexure of the colon here and the small intestine jejunum. So on the right side, it is like this, on the liver and the hepatic flexure as well as the jejunum and everything. On the left side, again at the upper pole, it is the suprarenal gland, but the other structures are different. Here will be the stomach, the gastric part, then we have the pancreas, the tail of the pancreas approaches here, and the spleen here, and the polyflexure and the jejunum. Here is the difference. Okay, here it is the liver, here it is the tail of pancreas, and the gastric part, the stomach part, and the spleen. Okay, so this is how it is different on the right side and left side, the relations on the right and left side. Posterior relations are almost similar. It will be mainly the muscles. There are three muscles. One is called as the psoas major muscle. Psoas muscle here. Then we have the quadratus lumborum and the transverse abdomen. These are three muscles which are on right and left side same. Okay. The posterior relation is by three muscles. One is the psoas major. The second is the quadratus lumborum, and the third is the transverse abdomen. It is same on both the sides. Only the anterior relations are different. And in this kidney, you should know the relations because there is an objective. So don't come later and ask me whether relation is important or not. Okay. So relations are important because there is an objective here. Okay. So this is the relations. And here there is slight difference on either side, but the posterior relations is the same. Apart from these relations, there is also a very important relation, that is the relation of the ribs on the right and left side. Okay. Why it is important? I will talk about that later. First, you know the relation part. Okay. So if you see on the right side, as I said, the kidney is slightly lower compared to the left side. So this is the left kidney and this is the right kidney approach from behind, not from the front, from behind. Okay. So if you see here, the right kidney, because it is slightly lower, so only the 12th rib is passing through it. But on the left side, the 11th and 12th rib both will pass through the kidney. So there is a difference between the right side and the left side. Why it is important? Because of this. Okay. Because whenever you are approaching the kidney from behind, you should know the relation of the kidney. If you are doing any surgeries, you should know the relation of the ribs. Okay. So there is something called as the renal angle. Renal angle. Okay. It is an angle between the lateral border of the erector spinae muscle. There is a muscle on either side. Okay, which is called as erector spinae. Erector spinae is a muscle which will erect the spine. Spine is the vertebral column. Okay. So this muscle will help you in erection. If you are bending like this, if you want to stand like this, it will help pull a strong muscle which will pull along with other muscles and make you erect in erect position. Okay. So this muscle is called as erector spinae. It will be here. Okay. On either side. Two muscles on either side. Just beside the vertebral column. Okay. This is called as erector spinae muscle. Okay. This angle is at the lateral border of this. This is the lateral border of this erector spine. This is the muscle. If you imagine this is the muscle, so this is the lateral border of this muscle. So it will be here. Okay. On the other side, it will be here. It is an angle between the lateral border of the erector spinae muscle and the 12th rib. It is an angle between the lateral border of the erector spinae muscle and the 12th rib. Okay. The lower part of the posterior surface of the kidneys lies below this renal angle and not encroached by costodiaphragmatic recess of the pleura. What is this costodiaphragmatic recess?
Below the lung.
Below the lung.
Yes, yes.
What exactly?
I remember. Sorry.
What is it? What is this costodiaphragmatic recess?
It's between the diaphragm and the...
Yeah.
Uh,
What is
It's-
it?
There is a space. It's collision.
It's,
Space.
uh,
Yeah, good.
If the
It is a
infection
space. Yeah, good. So it is a space within the pleura.
Yes.
Okay. Where if there is any infection, as your friend said, if there is any infection, it will collect there. Okay. So it means it is the lowermost part of the pleura. Okay. So this is the importance. So the lower part of the posterior surface of the kidneys lies below this renal angle and is not encroached by costodiaphragmatic recess of the pleura. So when you approach at this angle, it means you cannot approach the costodiaphragmatic recess. Okay. if you approach from here, if you put some needle or something inside, you don't puncture this post-diaphragmatic recess.
So it's surgical important.
Surgically important. Okay. So now imagine 12th rib is missing.
Huh?
12th rib is missing.
Yes.
So now you take the 11th rib as the 12th rib because you don't know. You did not check properly. Now you take the 11th rib as the 12th rib.
You
And
bunch,
now you approach this renal angle.
Yes.
You imagine what is the renal angle? The angle between the lateral border of the erector spinae and the 12th rib. And you don't know that the 12th rib is missing. Now it is between the 11th rib and the lateral border of the erector spinae.
So you
Now you
bunch
punch it. What happens?
the pylora. There will be opening in the
Yeah,
pylora.
you will puncture this recess. If you puncture this recess, what will happen?
Infection that accumulate.
Okay, there is infection, then you are draining it. Okay. If there is no infection, what will happen?
Respiration. Respiration.
Respiration, what will happen?
Education.
You will start respiring from there.
There will be air maybe. Or
What happens?
air.
What is pleural pressure?
Yes.
Is it positive or negative?
Negative.
Negative. What's the importance? Why
If
it is
positive,
negative?
there will be
It helps in respiration. Now you are puncturing this pleura.
become
What will
positive.
happen?
More
It becomes
positive.
positive. Now you cannot respire. Difficulty in respiration. So collapse of lung and death of the patient. You are treating the patient for the kidney and you are killing the patient. So that's the importance of this angle. Very important angle. So it is the angle between the lateral border erector spinae and the 12th rib. Okay, so you should know that this is the 12th rib before you puncture. Confirm it with the x-rays and other things, whatever way, the shape of the 12th rib, and count the ribs from above downwards, everything. Then puncture it. If you miss it and if there is no 12th, sometimes it is absent, 12th rib is absent. Or it is very short and you cannot make out, and you puncture this area and you might kill the patient. You can puncture this costo-diaphragmatic recess and you open the pleura, and the pressure within the pleura becomes positive and there is difficulty in respiration and the patient dies. Okay, so that's why surgically it is very important. Okay, this is what I said. If there is 12th rib missing, then you can puncture. And I said medically it is important because the colic pain, as I said, the colic pain starts from here and it winds around and goes into the groin. It is called as pain from the loin to the groin. Surgically, you can approach this kidney from behind here. Kidney exposed retroperitoneal by an oblique incision extending from the kidney here, from the renal angle. You can give an oblique incision and then you can approach the kidney. If you want to remove the kidney or do any surgical operations on that, you can. This is the angle where you do the surgeries. So before you do the surgery, you should know what is the complications related to this. Okay. So this is the angle. So in the examination, but there might be a short notes or something like that related to that. Okay. If they ask you what is renal angle, then you should be able to tell it is an angle between the lateral border of the erector spinae muscle and the 12th rib. Then you can mention the clinical importance of this. Okay. Coming to the blood supply, it is supplied by the, as you can see, a thick artery called as the renal artery. It is a branch from the abdominal artery. Okay. If you see the development, we'll talk about the development in short later. It is actually in the form of lobes or segments which join together. There are 12 segments which are joined together, and then it is formed into a complete kidney. So that's why you can see the lobulation still. Okay. So each segment is supplied by a segmental artery. So it will, if you see here, the artery is there, single artery, renal artery, it is divided. Okay, into segments. Okay, it is called as the vascular segments because the vascular segments, they don't cross each other. Each segment is segmented, or each lobe is supplied by a single artery, segmental artery. Okay. So there are around 6 segments here later after development. One is called as the apical, then the upper, middle, and lower, and the posterior. So these are some of the 5 or 6 segments which are there. But initially during development will be actually 12 segments which have fused together to form this final segments. Okay. So these are called as the segmental arteries, and each segment is supplied by a single artery. Apical segment, upper, middle, lower, as well as the posterior segments.
This segment, the renal artery itself.
The renal artery will go and divides into anterior posterior division, and then it gives segmental arteries. Okay, smaller, shorter branches. You see here, it is dividing into shorter branches, and each will supply by this artery. Okay. Coming to the venous drainage, it is by the renal vein directly into the inferior vena cava. Okay. Lymphatic drainage by the lateral group of aortic lymph nodes which are near this artery. Okay. There will be small group of lymph nodes called as the pre-aortic as well as the para-aortic and the lateral group of aortic nodes. So it will drain into this. Nerve supply will be by the renal plexus, which is formed by the sympathetic and parasympathetic. Sympathetic by T1, T10 to L1, and the afferent will be from T10 to T12 segments. And the parasympathetic, as you know, will be from the vagus. Okay. This is about the kidney, and some features of the structure it will be more covered in the histology, but some of the features can be seen even with the naked eyes. That I will tell you. The histological features will be covered in the histology. Okay. Structures. If you take a vertical section like this and see, you can see something called as the renal cortex. This is the cortex, and the inner part, paler part called as the renal medulla. So there are two parts: renal cortex outside and renal medulla inside. And in between there are small spaces. These are called as the renal sinuses. Okay. So there is renal cortex, renal medulla, and the small spaces called as the renal sinuses. Renal medulla is made up of 10 conical or pyramidal shaped structures. These are called as the renal pyramids. This is the pyramid. And the apical part of this pyramid is called as the renal papillae. This part is called as renal. This is the pyramid. It is because it is in the shape of pyramid, so it is called a renal pyramid. And the apical part will be called as the renal papillae. And these will be opening into spaces here called as the minor calyces, or single is called as calyx. Okay. This is the place where the urine is drained. Once the urine is formed, how the urine formed again it will be covered in histology and the physiology part. So once it is formed, it will be drained into the space. This is called as the minor calyx. So these minor calyx will join to form the major calyx. If you see here, these are the major calyx. These are the minor calyx, these are the major calyx. And then they will drain into the renal pelvis. This is the pelvis, and then they will drain into the ureters. Okay, this is the whole process of that. So here is what you can see with the naked eyes is the renal cortex and the medulla. In the medulla there are pyramid shaped structures. These are called as the renal pyramids, and the apex of it will be called as the renal papillae, and they will be draining into the minor calyx. The renal cortex, this the renal cortex will be having something called as two parts. One is called as the cortical arches, which are just above the renal pyramids. This is the renal pyramid. Above that is called as the cortical arch, and in between there are something called as the renal columns. Yeah. So within the cortex there are two parts. The cortical arches, which are above, they form a cap around the base of the pyramid, and there are columns. These are called as the renal columns. Renal space, renal sinus is a space here. This is the space here which will contain small branches of the renal artery, renal vein, as well as the renal pelvis. All this will be present here, small branches you can see here. So that is what is present in the renal pelvis. Okay. The pelvis, as I said, this is the pelvis, renal pelvis, which will contain the ureter. It divides into three major calyx. Okay. These major calyx will divide to around 30 minor calyx. Okay. So these are minor calyx, these are major. These are 2 or 3 major calyx, and these will in turn divide to around 7 to 13 minor calyx. And each minor calyx, around 2 to 3 pyramids will open into each minor calyx. So they will be all draining their the produced urine into this minor calyx. From there to the major calyx, and there from there to the renal pelvis and the ureter. This is how the urine is formed. Coming to the development, some important feature. I will not go into details. Yeah, separate lecture. Okay.
Yes.
Okay, good. So I will just tell you some important features. That's all. Okay, not much. So as it is, the kidney is developed from 3 parts. One is the main part is the intermediate mesoderm. Mesoderm are 3 parts again. So this developed from the intermediate mesoderm, and from there, from 3 parts, this is called as pronephros, mesonephros, and metanephros. Pronephros and mesonephros are temporary. Finally, the kidney is formed from the metanephros. Okay. So actually, as I said, the kidney develops in the pelvis. Slowly, they ascend upwards. Okay. So they are ascending upwards. Along with that, if you see here, when it is in the pelvis, the renal arteries are from the branches of the iliac arteries, common iliac arteries. When they ascend upwards, even the arteries will change. Initially it was down. When it has ascended, the arteries are also ascended.
How change? How change?
So this is how they change. Some of the structures they change here. Usually they don't change. If you know, the testes have
From
which are here,
abdomen
the
and
scrotum,
tuber.
they were initially in the abdomen.
Then
If
go
you
to
see
the
the testicular artery, it will be still in connection with the abdominal aorta from where it has come. Okay, it has now changed. So even though the testes have descended downwards, the artery has not changed. But in case of kidney, it changes. When it ascends upwards,
What's the point of change? How change? What's the point of change?
whenever it changes, goes upwards, at that time it develops a new artery. Okay, then it gets supplied. Then when it ascends upwards, this degenerates. A new artery is formed. Again, when it ascends upwards, this will degenerate and new artery is formed. This is typical for the kidney. If not, usually it will not change. Okay. This is important because whenever you go clinically at that time, there might be multiple arteries. Sometimes the renal artery is not from the abdominal aorta, but from the common iliac or the external iliac somewhere. Okay, then you should know this is because of the developmental anomalies. Okay. As I said, the kidney is also lobulated when it is during development, but later it fuses. Sometimes it doesn't fuse, so there might be multiple kidneys. Okay. Okay. Sometimes all this will fuse, but in an abnormal fashion. Both the lower poles of the kidney have fused together. So this is called as the horseshoe kidney.
It is good.
It is good. Okay. So sometimes it produces a lot of complications. Okay. Okay. There is both the poles, lower poles have not separated. They got fused together. So it is called as the horseshoe kidney. Sometimes it is also called as pancake kidney. Okay. Okay. Sometimes there might be the pelvic kidney. The kidney, one kidney has, if you see this picture, one kidney has ascended upwards, but the other kidney is still in the pelvis. Okay. So when you take an X-ray, then at that time one kidney you see, the other kidney is missing. You think that there is no kidney at all. Okay. So you have to check the pelvis also. Take an X-ray of the pelvis also. Sometimes the kidney might be there below. Okay. Okay. So in the pelvis, because it has not ascended. Now you should know why it has not. You should know why it is in the pelvis, because it has not ascended. Okay. Sometimes there might be lobulated kidney. If you can see here, both the kidneys have come to one side and it is lobulated. Multiple lobules are there. Okay. Sometimes there might be double kidney on the same side. There might be two kidneys. Instead of two kidneys ascending upwards, it has the second kidney.
Now it is good.
Now it is good.
You mean,
Both the kidneys have
doctor,
come to the
it's
same-
2 kidney, but same side or
side.
3 kidneys?
No. Two kidneys on the same side.
It's not
Sometimes there can be 3 kidneys also, as you said. That is because the lobulation has not fused together. All lobules have to fuse. Sometimes they don't fuse together. So there might be multiple kidneys. Sometimes the renal artery, as I said, the renal artery might be coming from the common iliac or the lower part of the aorta, not from the upper part of the aorta. So all these are because of the abnormality, because of the developmental anomalies of the kidney. Okay. So if there are any kind of anomalies, you should know why it is so. Okay, so typical features of anomalies are there because of the non-ascent of the kidney or the change of the position or the arteries themselves. Okay, so this is about the kidney. If you have any doubts regarding this, you can
There is no model, doctor.
models we have. Okay, like this, the whole thing, or sometimes there might be separate kidneys also. Okay, so you should be ready to identify the kidney, the position.
Okay, how different between right and left?
Yeah. So if you see here in these models, you can see the kidneys. So they might ask you here or then here or somewhere. Okay. So there you can easily identify.
Yes.
But here, if they like this, if they give, then you should be able to put it in the proper position.
This is flat.
Hmm?
Yes.
Not only flat,
You
I said the
can.
structures which are,
Yes.
yeah, that
But
is important.
the flat surface posteriorly.
One is medial is concave, then, okay, I can put it like this, then it becomes medial concave.
Yeah, but it's the flat surface should be
Flat
posterior.
should- okay, here it is flat, good. But here if you can see here, both the sides are flat. How do you make out? Here it is good, it is anterior surface is bulged, so you can identify. But here, sometimes it will be just like that. It is very difficult to identify which is the flat surface. At that time it becomes difficult. Okay, so always try to identify the pelvis first. So that is the most easy part. Okay, try to identify the pelvis at the hilum and see that it is
The pelvis should be where?
posterior.
Posterior.
Yeah, like this here also. Okay, so most posterior will be that one, and then we have the artery here. So this is the artery.
Exams come together.
Hmm?
So I know. I think exams come together.
Maybe separate.
لا دايم
Single kidneys are also there. Okay, we can use anything. Okay, so you should be careful. So always try to put. Okay, the pelvis on the posterior side.
pelvis.
Then we have the artery. Here it is colored, so you can see, identify the artery. Then the most anterior will be the vein. So this is the renal vein, renal artery, and the renal pelvis. Okay, so this is the arrangement of the structures. Okay, then it should be medially concave, and the upper pole should be always occupied with the suprarenal gland. Here it is not there, but if you see the model, it will be. Okay, actually it should be covered, but I don't know why. Always it will be covered with the suprarenal glands. Okay, in these models we don't have the specimens. Okay,
different renal pelvic from right and posterior. Different
pelvis. See, if you turn it like this, it becomes most anterior. Or if you put it like this becomes most anterior. So then, yeah, it should be posterior. One is posterior. Then it should be, the concavity should be medial side. Okay, so put it on the medial side, and this ureter should be directed downwards. Ureter should be downwards, and on the upper pole usually there might be a suprarenal gland.
If the kidney, separate kidney will come, it will come with the pelvis, right?
With the pelvis, yeah. Always it will be with the pelvis. So
Actually, we can differentiate only with the pelvis.
with the pelvis, okay, because artery and vein, as I said, it is difficult for you to
Yes.
differentiate. Okay, unless it is marked like this. Here it is redly marked, so you can identify. The thing is, the renal veins are usually dilated and thin wall. Okay, thin wall, and they have dilated. Arteries will have a thicker wall.
Yes.
And narrow.
Mostly artery.
Yeah. And the pelvis is most behind. Okay, this is how you can identify, and they might ask you any of these areas, because if they mark just this area and they ask you to identify what is the structure in relation, anterior relation of this structure, then first they might not ask you the which kidney, right kidney or left kidney, or what position. They might just mark this area, and they might ask you what is the structure which is
You
in
mean,
relation to this part.
You mark
Now-
lobe.
Yeah, maybe lobe or the surface. Okay, now you have to identify whether this is right kidney or left kidney first.
Yes.
Because on the right and left it is different.
Different,
relations.
yes.
So you have to identify. They might not ask you, but you have to identify first which is right or left. Then say what is the structure here.
So the
Okay.
formality finish.
Hmm?
The formality of that finish.
Yeah. Okay. So if it is right side, then you have to identify. They might mark you here. If it is on the pole, you can easily identify that is the suprarenal gland. Here will be the liver.
So
hepatic
we
area.
will tell the relation of the
Particular area.
bulk area.
Yeah, yeah, particular area. Okay, here will be the colon.
not the whole
and
anterior relation.
they might ask you the whole relations, or they might ask you one particular area. If it is whole area, you can easily tell.
Yes.
1, 2, 3, 4, 5. If it is particular area, then you have to think
Yes.
what exactly is there. Okay. So here will be duodenum. Okay. The three parts of the curvature of the duodenum on the hilum of here. Okay, in front. Okay. Here will be the jejunal small intestine. Here will be the colon, the hepatic flexure, the colon. Here will be the here liver itself and suprarenal gland. Here on the left side, it is different here. Here mainly at the hilum of the kidney will be the tail of the pancreas. That is most important. And above that will be the stomach. And here will be suprarenal gland, and here will be the spleen. Okay.
So
Yeah.
spleen
Spleen here. Okay.
colon.
The colon will be down, and the jejunum and the small intestine will be here. Same like here. But here the only difference is the spleen, the tail of the pancreas, and the stomach. Here it will be the liver and the duodenum. Okay. Others are same, almost same. Posteriorly, we have three muscles here. So identify the three muscles. One is the psoas major. Yeah. The two other muscles. And just it is the same relation on both the sides. So posterior not difficult. Anterior relations you should know properly. Okay. So to identify anything, you always remember these three structures, and always put this pelvis on the
Posterior.
side. Okay, and then try to identify. Okay, and if they ask me the model, it can be easily identified there. Okay, yeah. There it will be much more easy. Okay, in the examination, everything is there. The pelvis is there, suprarenal gland, everything is there, and the position is also in the proper way.
And relation is easy.
Relation is also easy, so easily you can make out. Here if they ask you independent, then it becomes difficult for you. First you have to identify the kidney, which side, then put it in proper position, then try to tell the relation and other things, whatever they ask you. Okay.
Thank you, sir.